My name is Danny Rodriguez. First, I'm going to share my screen really quickly. Okay. So as Ms. Tisa said, I'm an intern at Mental Health America. I'm a senior at UH, and my capstone for my major, which is public health, is mental health, and specifically women's mental health. So thank you guys today for joining me. I'm super excited to share. So yeah, first slide is Women's Mental Health 101. So here's our table of contents. This is what we will be covering today. So first, our introduction, so an overview of mental health, then women's mental health, so the basics of specifically women's mental health. Then I will cover some signs and symptoms, some ways to catch symptoms earlier on. Then I'll cover factors of mental health, other things that can impact one's mental health. I will cover some coping mechanisms specifically for women that can help with poor mental health, and a conclusion. So first, what is mental health? So as we know, mental health can have an impact on anyone and everyone. We all have an idea of what mental health is, but according to the CDC, mental health includes our emotional, psychological, and social well-being. It affects how we think, how we feel, and how we act. It also determines how we handle stress, relate to others, and make healthy choices. So a clinical study that was published online, The State of Mental Health in America of 2023, Adult Prevalence and Access to Care, states that there are 50 million people, or 21% of adults, that are experiencing at least one mental illness in 2023. So from the same study, of those 50 million people, only about 55% of adults with mental illnesses have received or have not received any treatment, meaning majority of people do not seek out any kind of treatment when they are experiencing a mental illness. And 5.44% of those adults experience a very severe amount of that mental illness. And here I will cover a graph by the CDC. This is from 2020, I believe, but it covers the severity of depression symptoms among adults, specifically comparing men and women. And we can see any severity, mild and moderate and severe severity of depression symptoms. But as shown on the graph, women unfortunately suffer the consequences of poor mental health more than men, and this is common with depression and as well as anxiety. So now I will cover women's mental health specifically. So women's mental health, why should we focus on just women and not men or both together? As we saw on the last slide, women suffer the symptoms of depression and anxiety, which are some of the most common mental illnesses, unfortunately. So that's why I believe it's important to focus on women's mental health. And gender plays a huge role in all aspects of mental health. Things like genetic and biological factors can impact how one goes about life and can impact mental health. Women have significantly higher frequency of depression and anxiety in adulthood versus males, according to the NIH, the National Institute of Health. So next I will cover signs and symptoms of poor mental health. So there's a few symptoms that you can look out for in general. This is not only just for women, but just everyone. Difficulty functioning in life, changes in mood and emotion, and risky or uncharacteristic behavior. So these are things to look out for everyone in your life, or within yourself. But specifically, symptoms to look out for women are irritability, decreased energy or fatigue, changes in appetite or weight, sleep difficulties, aches and pains, headaches, cramps, or digestive problems. These are according to the NIH as well, but it's important to look out for these symptoms, especially if they become more frequent and prevalent in one's day-to-day life. Now I will cover factors that impact mental health as well. There's a lot of developmental stages that women go through in life, and it's important to keep these in mind when considering mental health because one goes through so many biological changes during these times. So it's important to focus on these so we can look at the symptoms earlier on. So first one to cover is puberty and pregnancy, postpartum period, and menopause. Like I mentioned, lots of changes go, especially with hormones throughout these time periods for women. So it's important to identify them to be able to recognize the symptoms earlier on and hopefully catch poor mental health earlier on. COVID-19 has impacted a whole lot of mental health. Uh, Unfortunately, quarantine across the globe has imprinted lots of people and left many with poor mental health without being able to enjoy the things in life that we once were able to. A study done by the CDC states that 40% of Americans reported symptoms of anxiety and depression in 2020 compared to just 11% in 2019. So quarantine and inability to go out, enjoy the things in life, be able to work, hang out with friends frequently, and just enjoy life has caused a lot of people to go through anxiety and depression. And that's a big factor of poor mental health in today's day and age. Other factors that we can't ignore when it comes to mental health, and specifically women's mental health, are gender disparities, which can include inability to access resources, status and well-being, gender disadvantages, which includes patriarchy, sexism, lack of women in position of power, access to equal opportunities, and life disadvantages, which can include situations or things that one has no control over, but can ultimately cause a poor mental health or set someone back. So now I will cover coping mechanisms now that we know mental health and how it impacts women specifically. So first I will cover connecting with others, activities that one can enjoy, journaling, and tolerance skills. So first, connecting with others. Relationships and connections with others can allow for one to get out of a bad mental health space and enjoy life once again. It can also allow for one to build relationships with others. Building relationships with others can positively impact mental health, and it just allows you to build relationships. And yeah, so connecting with others is a big way to cope with a poor mental health. Indulging in activities, allowing oneself to do activities that can bring joy, and it can help a lot of people get out of a poor mental health space as well. Finding fun hobbies and hanging out and doing things that bring you joy can allow for one to increase dopamine levels, which ultimately causes better mental health. Finding things to do, whether it's just getting outside, cooking, painting, whatever it may be, any of the activities shown on the screen as well. Finding something that you love can really help get out of a poor mental health space. Journaling. Journaling has been proven to help those in poor mental health to allow them to understand their emotions. Being able to write down how you're feeling can help a lot with looking back and getting a better understanding of where you're at, if you've grown as well. Being able to see how much has changed over time helps a lot of people with poor mental health. And lastly, tolerance skills. So skills that can help with stressful situations and aid in the possibility of poor mental health. Things like accepting the feelings in the moment, practicing mindfulness, talking to a mental health professional can help with these feelings of anxiety and depression. It can also allow for one to help others. Once you are good at tolerance skills, you can help those in your life that may need help as well with this. So lastly, in conclusion, these are some resources available if you are struggling with poor mental health or someone in your life. These are for everyone, not women specific, but anyone can access these resources. I Am Alive, Mental Health America, online or over the phone, and the NAMI along with their phone number. But yes, thank you guys so much for giving me the time of day today. And yeah, thank you. These are the references as well.
Thank you so much for sharing, Danielle. I know there was like a brief run through of all the different pieces that were available for women's health. And you mentioned a couple of different items that were helpful. For activities, are there any ones that you would recommend for people to utilize that have been helpful for stress?
Yes, I would definitely recommend getting outside, whether it's working out, running, being able to just breathe fresh air, just being able outside, especially for people that live on island, getting out to the beach or just enjoying day-to-day things. Definitely getting outside is a good one, and journaling is really good. From personal experience, journaling helps a million times more with anything. It helps a lot with being able to see where you are, how you've grown. Letting it all on paper helps a lot.
Excellent. And you brought up one of the things, and I think that if people have attended Mental Health America of Hawaii trainings before, they'll notice that we're big advocates in terms of mindfulness and tolerance skills, is there any particular exercises that you like to do within the mindfulness range that you find to be really effective?
Yes, I would say breathing exercises are a
Mm,
big one. Being able to take a second and lower your breathing, especially if it's anxiety or depression, you get in this headspace where you feel like you can't get out. So giving yourself the time to breathe and recognize where you are, it allows for a lot of redirection and a lot of thinking so you don't start to spiral.
excellent. And for those of you who may be interested in learning a little bit more about those tolerance skills and specifically some of those breathing exercises, if you go to our YouTube page, MHAF Hawaii, you will find a list called Munch and Learn. And that is where we teach people in very short increments in 10 and 15 minutes to be able to learn to do diaphragmatic breathing, progressive muscle relaxation, and those types of skills as well. We do want to open it up for a few minutes if people have any questions they want to ask about women's mental health or mindfulness, that we'd be able to do that now. Please feel free to drop those questions into the chat if you have any. Again, we'll make sure that when we send out our list, email response to all of our attendees, that we do include the PDF of today's presentation. We'll also include that information regarding the Munch and Learn series for the coping skills and the video for today's presentation. We'll also be sure to include those finding resources, guide links, and the crisis resources that you're able to connect to those as well. I don't see any questions in the chat. So thank you so much for coming today. And thank you, Daniela, for introing us into mental health for Women 101 today. Someone just told me that the chat is disabled. So if you do have a question, oh, yes, please put them into the Q&A. And we see some coming in right now. Thank you so much. The question we have for you, Danielle, is do you feel women have more pressure to heal versus men?
That's such an interesting question. I feel as though women do have that kind of expectation in a way in society to heal compared to men. This goes with a lot of like patriarchal ideals, and it's really difficult to get around, but I believe it's changing over time. A lot more conversations about men's mental health as well, which are great, allows for both sides and everyone included to understand mental health and reach out when you need help, which is a really great thing. So I think yes, in a way, but also it's evolving to where everyone's starting to understand their place and their role when it comes to mental health, and reaching out and asking for help is not seen as a bad thing as much as it used to be. So
Yeah. And I would just note that there's a lot of different types of stigma related to people's experiences. And so the healing and the capacity to feel like people are open to discussing that with you looks very different, whether that comes from, how you've been socialized with your community, your ethnicity, your age. There's just so many different elements that go into that. And I think that the importance is to continue to have those conversations, to destigmatize talking about mental health. And that we have to be really kind of familiar with the idea that care and healing is an individual process, and that sometimes, no matter which kind of place that you fall into, it's often overlooked in terms of being able to get the care that you need because you're sacrificing, because you have a lot of different roles, whether that is a parent role or someone in a business or a sibling. There's just different demands that happen that can kind of put that on the back burner. And I think we're seeing now the impact that the last 2.5 years have had, and the importance of us all saying it's okay not to be okay. And it's really important to reach out and say that you need help if you do. Excellent. Thank you so much. I don't see any other questions regarding today's content. I'm just going to double check again. Thank you so much for attending. Again, if you have any questions as we move forward, you can call us in office, and you can also reach us through email, info@mentalhealthhawaii.org. If you have any questions regarding any of the presentations we give, and we really appreciate all the assistance we get from our students who come in and help us to grow our different programs. So thank you, Daniela.
Thank you guys. Have a great day.